we're talking about autism, one of the neurodevelopmental disorders, and we're going to delve a little bit deeper into some of the things that cause autism and how we can address it. One of the key things that have given us the most results has been the discovery, well, not our discovery, but discovery before by other people, that a lot of what goes on in the brain is affected by what goes on in the guts. And you can see these red lines showing the influence. And especially what goes on in the gut. So this is a diagram, if you haven't noticed, this is a diagram of the stomach and the digestive system. So what we found out was that children with autism, and maybe some of you parents have noticed this, that they have digestive issues. Not mentioned in the top 3 signs of children with autism, but most children with autism have some degree of constipation and in other cases diarrhea, or sometimes a combination. So they have those symptoms going on. So what was causing those things? What we now know is that there are microorganisms in the gut that influence to a very large extent what goes on in the brain. And this is not just about children now, but adults as well. Your moods, your appetite, your food preferences, even sex can be influenced by what's going on in the gut. I know that sounds hard to believe, but it's very, 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 very true. Again, if you do some research on your own, you will find that out. So it's not just about the bacteria. We have viruses. As a matter of fact, some people in the US, some researchers focus on treating viruses alone. Other people focus on treating yeast infections alone. Infections, so like candidiasis. All of these, in many cases, are at work in the guts. And so we see that in children, that they seem to have a preponderance, an excess of these what we call bad bugs. And they are influencing what is going on in the brain. And so if I were to ask you, what would be your approach to this? I know you're not a doctor, but what would be your approach? Having established the fact that the behavior of your child is driven by what's going on in his belly or her belly, what would be your approach? We found out that the best way, the best start was to find a way to safely, there's our word again, safely, push out or remove the bad stuff so the child eventually excretes that. That was what we now found out. So for the first 1 or 2 months, the goal is to slowly remove that out, and there's a safe way to do it. Of course, we can't share that on TV because it's a specific way to do it. But you can find out from your doctors and from other physicians in the field. You can slowly remove that. Once that is done, and ideally, you should have 85% good bacteria. Everybody has bacteria, so there are some good bacteria that are helpful. There are some bad bacteria that are obviously not healthy. The goal is to reestablish this right ratio. So 85 good, 15% bad. If you were to compare a child with autism's guts to a normal, what is known as a normal typical child's belly, you will find a clear-cut difference. You'll see that one is clearly not healthy and the other one is more healthy. So the goal is to try and push the healthy child's guts, the child with autism's gut health, and make it as close or approximate the normal child's gut as much as possible. This is really the first step and the most beneficial step to setting the child on the right path towards health and normal function. So we kind of established that the first thing you want to do is to try and get the stuff out of your gut. Now, you don't go crazy on me, because it's not just a question of just flushing your child's insides, because the healthy bacteria have to be there as well. So you don't want to just get rid of everything. And so there are certain supplements, there are certain approaches that can help to reestablish the what is known as the gut flora, the gut environment. So you need things like enzymes, probiotics, and other things that can help to reestablish a good, healthy gut environment. Some children simply lack the enzymes to digest food particles. And so sometimes that food particles can get into the blood, those undigested food particles can actually get into the bloodstream and actually go to the brain. Now, there's supposed to be a barrier here, but this barrier doesn't always work. It's called the blood-brain barrier, BBB. But from what we've seen, there can be a lot of the continual damage as a result of all these chemicals and these bugs. By the way, bugs and viruses and bacteria also secrete some really bad toxins, so they can get into the blood and actually affect the brain. The BBB doesn't work as well. So once we've established that, the next step is also to heal the guts. So there might be produce anti-inflammatories to heal the walls of the gut so that they're not leaking. There's a term called leaky guts. Again, there are certain things we can do to help to improve and close up those holes and enable it to get back. Now, back to the brain. Once we've kind of like plugged this, again, this doesn't happen within a day or two. It could happen over a period of time, like 1 or 2 months. Once you've stopped these bad stuff from going up, the next thing that you can do, there are things that can help to remove heavy metals. There are things that can help to remove chemicals. And of course, the immune system. There's what is known as neuroinflammation. If you followed our last talks, you remember we talked about inflammation can happen to the arteries and to the blood vessels. Well, inflammation can also happen to the brain. The brain doesn't have any pain receptors, but it certainly can be affected by neuroinflammation, which is really caused by the immune system. Remember, I talked about it earlier that in my class on autism when I was a medical student, the main thing we were told was that autism is an autoimmune disorder. That in autism, the immune cells are attacking the body, especially attacking the gut and the brain. There are special agents that can also help to reduce the attack by this immune system and actually basically rein the immune system in so that it doesn't attack itself like it was doing before. Now, in some cases, the child may have seizures, and once those are diagnosed, the doctor, especially if you notice it's like, for instance, those seizures may not be this wild, aggressive seizures where the child is thrown on the floor and is foaming out of the mouth. They could just be subtle signs, like child will just go blank. He may be walking around or sitting down and just goes blank, just stares into space for a few minutes. That could be a seizure. So when you notice these things, be sure to go see the doctor, because there are medications that can actually address seizures. So again, you've got to be patient. This doesn't happen all of a sudden. These are just some of the things that we found out that can help kids who are dealing with these major issues. Once you get rid of the parasites and the worms and the viruses that are causing this problem, you will be shocked at how quickly these children begin to behave. Like some of the things that I get back from parents is that, well, for the first time ever, he's sitting down through an entire class, or they go to church and the child is sitting down through the church service. Before, the child was all over the place, running up and down. Other times, the child is like one of the things they say is that the child is like he's coming out of a fog. For instance, he's just understanding what we're saying to him for the first time. We don't have to say the same thing over and over again to him. He's like he understands what we say when we say it once. Other children are always banging their heads against the walls. You find out that you remove this stuff, you don't see that head banging anymore. Fecal smearing. Some kids are not able to control their bladder. They just pee on themselves or they poop on themselves. You find that some of these things can actually be controlled and constrained once you begin to do the right thing and help these kids with autism. So those are just a few tips. I hope I haven't thrown too much at you. This was just one show, but if you have any questions on that, let us know. Send in your comments and all that, and we will hopefully address each of them and get back with you.